Imagine walking into a clinic for a routine checkup and leaving with a full-body scan, just in case. It sounds reassuring, like getting your car inspected before a long trip. But what if that scan, meant to protect you, quietly added a small but real risk to your health? Across the country, this scenario is becoming more common. Medical imaging has exploded in use over the past 2 decades, driven by powerful machines, patient demand, and the promise of catching disease before it strikes. Yet a quiet but urgent conversation is unfolding in the medical world. Are we scanning too much, too often, and without enough reason? At the heart of this debate are 3 familiar tools: X-rays, CT scans, and mammograms. They have saved countless lives by revealing hidden tumors, fractures, and internal injuries. But they all share a common thread: they expose the body to ionizing radiation, a form of energy known to damage DNA inside cells. A single exposure is rarely cause for alarm. The concern arises when scans pile up over time, especially when performed without clear symptoms or strong clinical justification. Radiation does not vanish after a test, it accumulates. And while the body can repair some of this damage, repeated hits may overwhelm its natural defenses, potentially increasing the long-term risk of cancer or weakening immune resilience. CT scans are particularly potent. A single chest CT can deliver radiation equivalent to hundreds of standard X-rays. These scans are invaluable in emergencies, like spotting a blood clot in the lung or internal bleeding after an accident, but their use has spread far beyond urgent care. They now appear in routine screenings, preoperative evaluations, and even wellness packages marketed directly to consumers. The line between necessary and excessive begins to blur when the motivation shifts from diagnosing a problem to chasing peace of mind. Mammograms add another layer of complexity. For decades, they have been a cornerstone of breast cancer screening, credited with reducing mortality through early detection. But the procedure is not without trade-offs. The breast is compressed between plates to flatten tissue and produce a clear image, a process that, while brief, can cause discomfort and, according to some researchers, may stress or even rupture delicate cells. Couple that physical pressure with repeated low-dose radiation over years, and questions arise about whether the screening protocol itself might, in rare cases, contribute to cellular changes. This is especially relevant for younger women or those with dense breast tissue, where the balance of benefit and risk is less clear-cut. What makes this issue so challenging is that the harms are invisible and delayed. Unlike a medication that causes an immediate allergic reaction, radiation damage may take years or decades to manifest, if it ever does. That uncertainty makes it easy to overlook. Patients often assume that if a doctor orders a test, it must be needed. Doctors, in turn, may order scans to avoid missing something, to satisfy patient expectations, or to protect themselves from legal risk. The result is a system that sometimes prioritizes certainty over caution, even when the odds of finding a serious problem are slim. Enter ultrasound, a technology that has quietly gained ground as a gentler alternative. Instead of radiation, it uses sound waves to create real-time images of soft tissues. It is widely used in pregnancy, heart exams, and abdominal assessments. In breast screening, ultrasound is increasingly seen as a smart first step for women with no symptoms or family history of cancer. It carries no known biological risk, causes no discomfort beyond mild pressure, and can effectively flag cysts, lumps, or other irregularities that warrant closer look. If something suspicious appears, then a more detailed, and potentially riskier, test like a mammogram or MRI might be justified. This stepwise approach aligns with a growing philosophy in medicine: start low, go slow, and escalate only when necessary. This shift reflects a deeper rethinking of what preventive care should look like. True prevention may not lie in more machines, but in empowering the body's own defenses. Lifestyle choices, consistent movement, nourishing food, quality sleep, stress management, play a far larger role in long-term health than most people realize. Regular self-exams, awareness of bodily changes, and open conversations with healthcare providers can catch issues early without a single scan. Supporting the lymphatic system through hydration, movement, and gentle massage may also enhance the body's ability to clear toxins and fight infection. These strategies carry no side effects, cost little, and build resilience from within. The tension here is not between technology and tradition, but between action and wisdom. Modern imaging is a marvel. It can peer inside the living body with astonishing clarity. But like any powerful tool, it must be wielded with restraint. The danger lies not in the technology itself, but in the assumption that more information always equals better outcomes. Sometimes, extra data leads to false alarms, unnecessary biopsies, anxiety, and cascades of follow-up tests that do more harm than good. Overdiagnosis, finding abnormalities that would never cause symptoms or threaten life, is a real and growing problem, particularly in cancer screening. Treating these harmless findings can expose patients to surgery, radiation, or chemotherapy they never needed. Public health experts are now pushing for smarter guidelines that prioritize individual risk over one-size-fits-all protocols. Instead of automatically screening every woman at age 40, for example, some recommend personalized plans based on genetics, breast density, lifestyle, and personal values. The same logic applies to CT scans. Reserve them for situations where the clinical suspicion is high, not as a fishing expedition. This requires trust, communication, and a willingness to sit with uncertainty, which is harder in a culture that equates action with care. Patients, too, have a role to play. Asking simple questions. Why is this test needed? What will we do with the results? Are there safer alternatives? Can spark more thoughtful decisions. Declining a scan is not about rejecting modern medicine, it is about engaging with it more consciously. Informed consent means understanding not just the potential benefits, but also the hidden costs. The broader lesson here extends beyond imaging. It speaks to a fundamental question in 21st century healthcare. How do we use our extraordinary technological power without losing sight of the human body's innate wisdom? Medicine has spent decades racing forward, building tools that see deeper, act faster, and intervene earlier. Now, the challenge is to pause, reflect, and ask whether every advance truly serves health, or merely the illusion of control. The goal is not to abandon imaging, but to refine its use. To scan when it matters, and to trust the body when it does not. To replace routine overuse with thoughtful precision. In doing so, we may find that the most powerful form of prevention is not found in a machine, but in the daily choices that keep our cells strong, our immunity alert, and our connection to our own bodies alive. In an age of high-tech solutions, sometimes the wisest move is the simplest one: wait, watch, and only then, act. Thanks for watching. If this topic sparked something for you, whether it's a question, a concern, or just a new way to think about your health, you're not alone. Medical technology keeps advancing, but your awareness is the real game changer. Stay curious, ask questions, and remember, more isn't always better, smarter is. Hit subscribe, tap the bell, and share this with someone who believes in health that goes beyond the scan. See you next time.